have access to that. Now, people with insurance, maybe people who have jobs. But, we talked about people with disability not even being qualified, and people not, you're walking into an organization. Thank goodness that there are a lot of skills that people can learn online these days. How many people with disability even have access to those things? So insurance is key if we want to do something at the policy level to incorporate and get more of these people, so that when you have the right professionals on ground who understand them, you can even see people who say, okay, because I know I don't need so much because I know government has covered for my care, I can easily go. Then going to your question, technology, there has been a lot of technology, but this time around, I said we want to move away from institution-based rehabilitation to providing some level of community-based rehabilitation, because there is no way everybody, how many teaching hospitals do we have? How many general hospitals do we have that can provide that? How do we make primary health care centers more viable? How can we make health centers in the community more viable to provide that? The government may not be able to invest in high-end technologies in some of all those little places. But when you have the right professionals who understand this problem, going there, exactly, making it look more like a community engagement, whereby the person, let me give you a typical example. How do we use locally made or locally readily available materials to make a bandage? Or how do we use, some of us who, like I played a lot, so I think I had some fracture when I was growing up. So I can remember not going to the hospital because my neighbor, who his father transferred his skills of setting bones, just got some sticks, got some bandage, wrapped it around my hand. And of course, I have my hands, I'm moving, I'm a physiotherapist, I'm able to practice with it. So how do we train more people to have those kind of crafts so that, we are not waiting for these disabled people to go into big hospitals to access technology before they can be treated. So little things like that. There is something we call parallel bar. Parallel bar is just a stick, two frames that enable somebody to learn how to walk again. I will be talking about walking because that's my domain, kind of. How do you get a bamboo in the community? Set a bamboo apart so that it can replicate that kind of parallel bar. A parallel bar may cost about 2 million to purchase. A bamboo just costs about going to the bush and cutting down the trees and setting it up for. So when you do that, the emphasis will not be so much on the technology, because look at Nigeria healthcare budget. How many percent goes to health? But when you talk about technology and, getting equipment or,
But where can the CSOs now? Because at the end of the day, we want adequate medical healthcare service. We want service providing whatever. I don't even know how to qualify it, because with all of these things you're saying, I understand the need to improvise. I understand the need to, they say half bread is better than none and all of that. But we need to get to that stage in Nigeria where our healthcare, services, or even the facilities that we have, the equipment that we need, are adequately provided for, be it from government and other CSOs. So I know you've been talking about the government a lot, and I believe to an extent that they're actually coming into reality, into what this cause is all about. But how can we get the CSOs now involved? How do we encourage donations? How do we call for support? What can be done basically to make sure that this aspect of disability inclusion is adequately taken care of?
Okay, so when it comes to what you've mentioned, there are principles that guide whatever it is that you want to do, and that falls in the arena of advocacy and empowerment. Now the CSO have a lot to do, which is what they have always done: usual community engagement, engaging with the government at various levels, understanding the barriers and the limitations so that they can push. Now organizations like Disabled People's Organization, which is organization set up, is a civil society organization by people with disability who understand where their pain is coming from. So when we organize programs, how do they, participate? And when government organize and when hospital engagements come up, how do they also participate and put it at the bare that these are the challenges we need, these are a few things that we need done for us to feel included in what we are doing.
Let me give Dr. Abi an opportunity to talk.
Yeah, it has become imperative for civil society organizations and even community-based organizations, faith-based organizations to be involved in this care of people living with disability. It's much more than talking. It's for us all to get involved, and this is the time where we all can be involved. Sometimes I see people in the society, they are wealthy, they want to spend money, and they feel that the only way they could do this is maybe to make noise through parties and some other spendings. One thing I want us all to know is that the donor agencies that are helping us in this regard, I think it's high time that Nigerians also should incorporate and be charitable to this cause.
More like, inclusivity. We don't like to use the word charitable because,
Okay.
yes. Yeah,
Okay.
Go ahead, quickly.
Okay, so that they too can be involved in a way that they'll be able to help people living with disability. Because when I see Bill and Melinda Gates Foundation, what they've done, and I believe even if they can't do like that, we could do at least 1%. We have people in the country that can come to this aid in this regard. So it's a call that all hands should be on deck for people living with disability in terms of access and infrastructural.
Yeah. Thank you so much, Dr. Abioye. Thank you. All right, if you're just joining us, it's still Disability Inclusion on Network Service of Radio Nigeria. We have less than 10 minutes to call this a wrap, and as usual, we'd like to give you a message about what the Disability Act states. So, what does the Disability Act say about health care? So, Section 21 of the Discrimination Against Persons with Disability Act 2018 mandates the government to provide persons with disabilities free access to adequate health care devoid of discrimination. So it also entitles persons with mental disability to free medical and health services in all public institutions. So thank you so much for staying tuned. It's sad that we couldn't take any call for today. I don't know why, but hopefully next week will be another time for you to, participate. So now let's talk about some sustainability of efforts now to improve access to medical services in the long term. Like, what's your recommendation? What do you have to say about, implementing this process?
I believe the best sustainability plan for people living with disability is to institutionalize rehabilitation care into the mainstream health care system of Nigeria, where every levels of government, we have a rehabilitation caregiver available, and we also have the space and all the prerequisites of the Public Act on the people living with disability is also institutionalized. Like it has become an offense for one to discriminate person living with disability. A line that they find is 100,000 naira when you discriminate, maybe in the line of job or other opportunities. In line with the sustainability of medical rehabilitation care or service in Nigeria, when it becomes institutionalized, the services will be available to all.
Okay. So, Dr. Namdi, would you like to add to what he said?
Okay, yes, so it's important. In 2019, when the Medical Rehabilitation Therapies Board organized the second international conference on rehabilitation. And one key message that we were pushing then was, how do government invest more in rehabilitation centers? When you look around, there are few rehabilitation centers to support the need on ground. There is an estimate that I found out recently. WHO said about 24 million Nigerians have one form of disability or the other, of course, which might include physical, mental, and so many other areas. Now, physical disability being the majority, as it's been stated there clearly too, rehabilitation centers that will have the right professionals, the trained and specialized physiotherapists, occupational therapists, speech therapists, prosthetists and orthotists, physicians in the field of rehabilitations, who could man this facility to make it so it becomes a lot easier that you now have the right, the round peg in the round hole, instead of someone going into the hospital and feeling the doctor or the professional doesn't understand them. So training is key. We need to invest more. We need to toe the line of building so many rehabilitation centers. When you go to countries like United States and London, like you talked about, you have a lot of rehabilitation centers on ground. I'll give you a typical example. When someone suffers stroke in a typical hospital in Nigeria, there is always an acute care setting, which is the hospital representation. And after that, how does that person go back to participating in the society? It's always a challenge.
I think that's
but rehabilitation centers will, not only look at the person in the impairment, which is the loss of one part of the body, but how does that person improve on his activity limitation and of course participate
we are
in
out of time. I'm sure
Yes.
you have a lot to say regarding this. I would sincerely like to even hear about it. Well, thank you so much for giving us that brief, highlights about, how to continue an incidence of stroke, apart from the fact that you get to meet, the doctor and he takes care of the aspect of, recuperating. You also need to follow up, on the issue. Sorry if you're unable to reach us via our telephone lines. We sincerely apologize. That's the end of this program, which came to you live from the Network Service of Radio Nigeria.